all, these are the areas which we are going to visualize for establishing either the female is virgin or not. Specifically, the main focus is, as you can see, the main focus is on the hymen, on the vagina, and specifically on some type of the posterior commissures, where in posterior commissure, if the recent act of rape or fornication has happened, they can have specific finding on them. Otherwise, if the person female is married or something, तो आपको बहुत specific findings नज़र नहीं आएंगी. तो mainly when we are going to differentiate between a false and a true virgin, but do you have any idea about the difference between the false and the true virgin? False virgin means where the hymen is intact, but that female has gone some type of sexual intercourse with the normal hymen intact. That can be because of, there are many types of hymens where the hymen is more like they have some holes in it. Septate hymen is there, more fleshy hymen is there, some loose type of hymen is there where the penetration is there, but it does not destroy the normal area. That in that conditions we have to see further examination. But in case of true hymen, the hymen may not be there, but the female is true virgin because of the accidental defloration, the accidental rupture of the hymen because of surgical interventions, horse riding, various type of exercises, use of tampons, and many other things. So type of hymens are basically you have in your I can say histology or anatomy you have done with that. So it's not very much important. But one thing is that which is written in the end, that is currently myriformis. This is the thing where the female, after giving birth to the child for the first time, the remnants of the hymen are basically there, which are just posterior and very small tags of the skins are there. And these should be differentiated from the ruptured hymen recently. Okay? And this can be differentiated by using hand lens, by using the examination. So this is basically how would you differentiate between the virginity and defloration. And the main focus is, first of all, in general, as the opinion is always there that hymen is there, hymen is not there. But as I told you, in false virgins, hymen is intact, but the act is there. There you can differentiate it by using that test which I told you that it is now obsolete, that is known as the virginity test, where fingers are passed, and if more than 2 fingers can pass easily inside through the introitus into the vagina, it is basically said that female is false virgin, and either the hymen is present or not. But in case of true virgin, it is not allowing more than tip of the little finger. Okay? That was previously done, and that was doing for centuries ना 20 अभी 1 साल ही हुआ है इसको ख़त्म हुए भी, और अभी भी बहुत से एग्जामिनर्स हैं उनको पता भी नहीं है. तो आपको यही बात हम अभी CPC भी जो हमारी है उसमें भी ये बात डिस्कस करेंगे कि ये किस तरह है. सेकेंड थिंग इज दैट द मोस्ट इंपॉर्टेंट थिंग इज द रिग्वेसिटीज एंड द पोजिशन ऑफ विजाइना. If more rugosities are there, it is not so much accommodative to things, then we can differentiate it from like a habitual one from a just deflorated one. So these are the conditions where the hymen can be ruptured without having any specific type of rape or any other sexual intercourse. These are all the conditions. So a true virgin cannot have hymen because of either of these conditions. So false virgin, as I told you, hymen is intact, but the woman has had sexual intercourse. You can differentiate. This table is given in your books, where the two, as I told you, the difference between them are mostly because of the position of the hymen and the 2-finger test. Okay. Now, these are all the